To help us make sense of the latest outbreak in China and the many more challenges we might face this winter, I'm now joined on Skype by Associate Professor Zhao Dahai from the School of International and Public Affairs at Shanghai Jiao Tong University. He is also the Executive Director of Jiao Tong University and Yale University's Joint Center for Health Policy. Professor Zhao, we could really use your expert analysis on this matter. Most of the confirmed local cases in Hebei province occurred in rural areas. What does that say to you, and what's the most important thing in epidemic control in these areas in particular?
Considering the current early monitoring and response mechanism on COVID-19 outbreak in Chinese mainland is mostly for urban areas. The outbreak in Hebei province tells us that the local government cannot relax the guard for the potential outbreak in rural areas. I believe it's a good notice for all local governments in China to build the early monitoring in rural areas. The most crucial thing in epidemic control is lockdown of the area. All people in the area should stay at home. Further, the nucleic acid test is conducted for all people in this area. Actually, what these areas in Hebei province have done is accordant with the traditional control principle on COVID-19 outbreak. In addition, vaccinating the people in this area who are detected negative through nucleic acid test is another option.
Professor Zhao, we've seen a rebound in infection numbers this winter scattered around the country. What do you think is the likelihood of more infections yet undetected as we speak? You mentioned monitoring should be stepped up in rural areas. What about in general? How should we boost monitoring across the country?
I believe the likelihood of more potential infections occur is relatively high. Considering the Chinese Spring Festival travel is approaching, a large number of people will travel nationwide. This must further enhance the likelihood of more local outbreaks happen. In terms of the monitoring, I think at least 4 types of monitoring may work together. Specifically, the monitoring on suspected symptoms and travel history includes the community-based in rural and urban areas, workplace, public areas, particularly for public transportations, and the hospital-based. Through the operation of early monitoring mechanisms and key population who have been vaccinated, the likelihood of more local outbreaks will be decreased.
Professor Zhao, we certainly appreciate your analysis and expertise. Thank you so much for making time for us today.